Good afternoon. My name is Yvonne, and I'm a behavioral health provider here at MyClinic. I actually have been doing this for a while, since I graduated with a bachelor's in psychology and a master's in health sciences from University of Florida. So that's a long time ago, over 3 decades ago. And I've been working with patients in different settings for all my professional time. I love what I do. I get energized by the patients, by the clients, and the types of issues that I have seen during my practice. It's been very varied because I have done different settings, but mostly I see a lot of depression, a lot of anxiety, a lot of family conflicts, and just trying to facilitate a broken system. It's what pretty much energizes me. When I say broken system, it's about families that are not communicating or don't know how to communicate. And we do a lot of family here at MyClinic, a lot of family counseling, but the main thing that we do at MyClinic is getting the patients to be in charge of their health, motivated to do well, and to make sure that both areas are doing well. It depends, but no more than 1 hour, but when I have couples, it could take an hour and a half. Usually the intake process takes about 60 minutes, but progress sessions or following sessions could be 45 minutes. I don't take less than 20 minutes unless it's a phone call, because we also do telehealth. We follow up patients that can't come to my clinic by phone. Stress is part of life. We need to understand that managing stress, because stress can help you get things done, but when that stress gets to unmanageable levels and affects your sleep and affects your ability to deal with conflict, and it makes you irritable with your family or your work, then you need to learn how to use basic relaxation techniques. So we suggest patients to get into mindfulness, to get into visualization, visualizing, like in having some sort of a collection of almost like pictures, like calendar pictures, to have a collection of places that you can go when you need to pause and take a deep breath. So I guide the patients through the process of deep and slow breathing and finding pictures in their brain that they can use to utilize to make a pause and recognize when they're agitated and that they need to take a breather. So also accessing certain apps that are free in your phone and accessing YouTube videos that are in English and Spanish, depending on the language of the patient, will help them to sleep better and normalize their stress. Also, exercise is something that we always push here at the clinic. We want to look that the patient is taking time to do exercise, and that doesn't count what they do physically for work. So it has to be something recreational. It's already known, it's proven that exercise will help people sleep better, manage their stress better, and take me time away from their usual routine. So exercise is part of that. They're not very common here, but we see patients that have difficult relationship with food, that have probably a history of obesity, and that gets on the way. So that's considered an eating disorder. People that are depriving themselves from food in unhealthy ways. So we see certain eating disorders, anorexia, bulimia. I don't see that often, but I refer them to an alliance that is free here. It's called Alliance for Eating Disorders, and we work closely with them. They have support groups for free in West Palm. So that's one of, usually I screen people for eating disorders if they do have a bad, not bad, but inappropriate relationship with food. So that's part of the assessment to see what sort of relationship they have with eating patterns and food. Women tend to be more depressed than men because I think that many of the women that I see haven't have access, availability of psychological services or counseling services in their countries of origin. And if they are residents and have lived all their lives in the United States, there's a stigma about behavioral health that is thankfully changing. So we're normalizing that behavioral health is part of coping with general stress. So women tend to be more open to the idea of initiating and asking for help. They get depressed, but they're more eager to get the help. Usually I get men here because I have a lot of men in my caseload. They're getting to feel more eager to come because it's recommended by their doctors and they trust the doctors in my clinic. So if they recommend something, they want to follow up. Mm-hmm. Also, I see a lot of men with some substance abuse issues that interfere with their ability to earn money and pay their rent and be productive and be able to send money to their families. And that view of behavioral health as something that they don't want to share their life story with someone is changing, it's evolving. I see more men being receptive than women, but in general, genders experience the same. Men get depressed, women get depressed. More women have been victims of sexual abuse than men in the work that I've been doing here, but I still see men that have been assaulted and sexually abused as kids. Men tend to be anxious also a lot. So I would say I don't see that much difference between diagnosis between men and women. I see that women are more willing to ask for help more often. That's what I see. We assess just by asking what are things that you do on a typical weekend? How do you spend your time off from work? How much time do you dedicate to yourself, to your family? How much time do you dedicate to your phone? We talk about technology, we talk about social media, how those things interfere with that work-life balance. And we see in this decade, and as I see, these are things that I've seen change through the years that I've been in practice, that Facebook and social media, and they do use social media. A lot of my patients do use. It gets in the quality of life, and it is a conflict with their spouses. I see a lot of that, and that is brought to the attention of the patient, and I say, put yourself on a diet from the phone while you're at home. Just try to quantify your time and don't be a slave of technology. Share with your family. For women, divide the work because they tend to work full time, but they also are used to doing more of the home chores. That stresses them out. They don't go to sleep as early as men because they have to do more. They have to wake up earlier and do more. So I encourage them, women and men in my practice, to do what they need to do to, if they're men and they don't do enough, to increase the amount of chores that they do at home because they're giving a good example to the kids if they have kids, and to the woman, do not enable the men by doing things that they can do by themselves. So be realistic that we're in the 21st century and people have to fend for themselves. and you want your kids to be able to be independent. So for men to give the example to their kids and to support their wives if they have wives that are working more than what they do, and for that to make a list of chores and they can see clearly that the woman does more. So taking care of gender issues is part of a healthy life at home. So I do touch on healthy unhealthy division of labor, and for them to take advantage of what they like to do. There's no reason why men cannot clean more and cook more. So I educate them in that sense, and I see progress in their relationship and that they're getting along better. I love the team. We have an amazing array of volunteers, doctors, nurses, and amazing, full-time staff that it's a joy to see how with humor, with love and compassion, we try to help one patient at a time, and I see results. So it's a joy to come here and do something that feels good and helps people improve their health. Thank you.